Hi, everybody. My name is Megan Sutton. I'm a nurse practitioner. I specialize in heart failure and cardiomyopathy. I worked clinically managing patients for many, many years before joining the research division of pharmaceutical companies that were working specifically to innovate in heart failure and cardiomyopathies. I've worked on therapies like Entresto for heart failure, mavacamten for hypertrophic cardiomyopathy, and more recently, I've worked on gene therapies for genetic cardiomyopathies. My current role is at Evergene, where we offer free testing for patients with genetic cardiomyopathies. Today, we're going to talk about retesting. So imagine you've already had testing in the past for cardiomyopathy. You've been diagnosed with cardiomyopathy. You've gotten tested. It's been greater than 3 years, and you're wondering if there's any value in retesting. So we're going to talk through why to get retested, potentially, if you have been tested in the past. So we all know that genetic testing can provide invaluable insights. Those of you who have been tested in the past and found positive probably noticed that your care changed. You also probably noticed that your family got tested as well, and many of you probably had increased monitoring or referrals to specialty services. Perhaps you got an ICD, so your care directly changed based on your testing. But the retesting piece is really important. So we're going to go through the reasons why it's important to retest. Reason number one is that the tests actually change over time. In fact, they actually start to improve over time. So the testing that you got in the past may not include the new genes that we've discovered since then that cause cardiomyopathy. This is actually evolving every day. And so new genes are discovered, old genes are removed, and the technology is much more precise now. So if you have been tested greater than 3 years ago, you really should consider getting retesting. And why that's important too is if you've had a variant of unknown significance in the past, perhaps that variant of unknown significance has now evolved into something that is disease linked. So retesting can give you that sense of clarity. Reason number two, I mentioned the variants of unknown significance. Now, many of them that were labeled uncertain in the past have now been understood by science, and they're reclassified as disease causing. There was actually a study that looked at genetic testing, retesting in patients, and they found that 60% of the patients actually had a change in their variant of unknown significance when they were retested. So it's a higher rate of these changes than I think is really widely understood in the public. Really important for you to get tested if you haven't been tested in quite some time. And those updated answers may actually change your care, as I mentioned in the past. Reason number three is actually really important too. The guidelines actually recommend that you get retested. The expert professional societies like Heart Failure Society of America, AHA, ACC, there were a lot of publications from these medical societies that recommend the value of retesting. They mention every 3 to 5 years. It's really based on what your test was, what was on your panel, and whether the panel that you're going to test it on now has new genes. So that's the caveat there between the two tests. There are new genes added to the panels now. Variants of unknown significance have been updated, and so that's why it's important to get retested based on the societal recommendations. Reason number four is that all tests are not equal. So it's important that if you do get tested and retested, that you use a clinical grade test and partner with an academic institution or a lab that uses clinical grade testing to get a true diagnosis. And some of the older tests or the consumer tests that are consumer geared haven't necessarily been clinical grade. And so you want to use a clinical grade lab that's CLIA and CAP certified. And these actually are required for trials, clinical trials. So if you're interested in the clinical trial, you'll need that information to be able to be eligible for those trials. And so the retesting allows those results to be usable for treatment for your clinicians to make sure that they have a clinical grade, hospital grade test result, as well as help you continue to explore clinical trials as an option. The last reason is that your data can actually help others. So when you get tested as a patient, with every test, remember that the labs that are taking that information in are reclassifying information. If you previously had a variant of unknown significance, and now more of those patients have been tested and variants have been shifted from an unknown significant variant to something that is disease causing, it's because more patients have been tested. And we have more information now to show that linkage between the variant and the disease. So when I say that the panels are updated, it's patients like you that get tested that allow the science to evolve so that we can update these panels. So it's really important that all of the community contribute to that knowledge. And I think that it's important to say that once you're diagnosed as a patient with a genetic cardiomyopathy, that you can potentially explore things like clinical trials as a treatment and evolve research in that way. So a lot of good can come from you getting treated and having that data to not only evolve what the variants of unknown significance can look like and become, but also make sure that the clinical trials evolve for treatments. So just to recap, the genetic science really evolves rather quickly. And so it's important that you get retested within 3 to 5 years so that you can get the most up-to-date information about the genetics that are causing your disease. This will also help give you clarity as well as your family. So if you have a VUS in the past or you were negative in the past and you're positive now, that will affect your family testing. They will need to get tested as well. And so those updated results can not only guide your treatment better, but help your family get better treatment as well.
This video is part of a series of educational videos developed by the Genetic Cardiomyopathy Awareness Consortium and brought to you by the DCM Foundation. Our goal is to connect you with the leading experts in the field of cardiomyopathy to further your understanding of this disease and to provide resources to help you manage your care. Thanks for watching.